Hi, I'm Gary White for Channel 6, Central Kentucky Television, and I'm here with Dr. Trish Ciccone at Central Kentucky Optometric Associates with offices in Lebanon and Springfield. And as we're recording this, we've been going through a drought and very dry weather. And does that actually impact or affect your eyes as well?
It can. When it's warm and it's humid out, that actually helps dry eyes, because the humidity in the air just helps keep your eyes from drying out from environmental exposure. But when it's warm and it's dry, it's just almost kind of like the wintertime when when it's cold and dry. The drier the air, the less humidity in the air, the more our eyes will be affected by environmental exposure.
And now, like dry eye, when we talk about that, it's actually, you know, like that. The weather can affect it, so anybody can have dry eyes. But it's
anybody
also
can.
a disease as well that can be not necessarily affected by the weather, right?
Yeah, dry eye is a disease, and it's very, very much underdiagnosed and undertreated. And it's multifaceted or multifactorial. You can have dry eye and have what's called an aqueous deficiency, which is generally more autoimmune disease or related to certain medications that just reduce your production of the aqueous layer of your tears. Or you can have dry eye, which is more evaporative or environmental, where you're not making a good mucin or lipid layer of your tears, so your tears evaporate off your eyes very quickly. And so, or you can have a combination of both of those. And then environmental factors come into play. If you sleep with a fan on, or work with a fan, you know, blowing on you all day long, or if your eyelids kind of crack open while you're sleeping a little bit, or what's called lag ophthalmos, those all can contribute and exacerbate a dry eye. And then if you take certain medications, if you're on antihistamines, lots of blood pressure medications, medications that help you sleep, all of those medications also decrease tear production. So again, dry eye can be multifactorial, and you can have more than one underlying cause contributing. Someone who has a real marginal or minimal dry eye might, if with contact lens wear, might be more symptomatic than someone who has the same dry eye but doesn't wear a contact lens. So, yeah, lots of things can contribute.
Now, is there a treatment as well
for dry eye? Sure. The first thing with dry eye, and the way to get the best treatment for dry eye, is to actually get a formal diagnosis for dry eye. Because one, you got to figure out what's causing the dry eye to really customize the treatment for the patient to you know, solve their particular dry eye problem. So we use many different testing procedures. We have the tear lab, where we test for tear osmolarity. Elevated osmolarity is indicative of an aqueous deficiency. We have the inflammadry test that helps to determine if there's inflammatory factors and inflammation related to the dry eye. That lets us know, if you test positive on that, that you're probably going to do well initially with a steroid, and then maybe one of our longer term treatments that actually treat the inflammation, like Xiidra or Restasis. And there's different things about those two that may make us choose one over the other depending on that. And we test your basal tear secretion. We test your what we call your BUT, which is your tear breakup time. So we look for different types of staining. We take a good look at your meibomian glands to see if they're inflamed or they're clogged up, because they produce the oily layer of your tears. So it's a really kind of a very extensive workup for a dry eye, but you can tailor-made and you can really customize the treatment to the patient based on what we're seeing through the exam. Just going and grabbing artificial tears because your eyes feel dry, it may make them feel better for a little while, but it's not going to actually address the underlying condition, so it's not going to solve the problem. We will use artificial tears in conjunction with other treatments for dry eye, but our goal with dry eye is to manage and control the problem, and in some cases even solve the problem. as opposed to just using a crutch to make you temporarily feel better.
Right. So the first step is to contact Central Kentucky Optometric Associates. Again, they have offices in Lebanon and Springfield. Make an appointment, come in and see Dr. Saccone, and get treated or get tested. And then if you have official dry eye, you can be treated.
Yeah, and again, something that people don't realize is that, you know, dry eye is a medical condition, and most of the visits and the testing can be applicable and applied to your major medical insurance. So a lot of folks think, oh, I can't go in that, I don't have vision insurance. Well, you don't need vision insurance to pay for some of that testing. Medical insurance will cover that for most cases, less copays and deductibles and, you know, all that other stuff.
Right.
But yeah, it's a medical condition. It is truly, it can be debilitating. And so, you know, some of the more advanced treatments for dry eye, we can use amniotic membranes now are helpful in treating real severe dry eyes, or we use a thing called autologous. It's, a lot of people pronounce it autologous or autologous, or there's different pronounces, but basically it's a tear that's custom made from your serum from your blood. And we use a couple centers, one in the Louisville area and one in the Lexington area, to actually custom make some tears for people. And it's the healing, the cytokines and the healing factors and the growth factors in your serum, the serum from your blood that help to heal the corneal surface and reduce your dry eye.
Wow.
So we are doing some very extensive, you know, some things to really aggressively treat and go after dry eyes and really make people feel better.
Great. So give a call to Central Kentucky Optometric Associates, offices in Lebanon and Springfield, and the phone number here.
270-692-1871. In Springfield, it's 859-336-9388.
Great. Again, I've been talking with Dr. Saccone here at Central Kentucky Optometric Associates. This is Gary White for Channel 6, Central Kentucky Television.